My first question for you, Dr. Rusty, is how do you use an AMH test for fertility preservation?
Okay, so excellent. So we need to define two things first, fertility treatment and fertility preservation. So the difference is fertility treatment is when you're trying to get pregnant. So you try to conceive naturally, you didn't get success, then you're having fertility treatment to have your next child. So you want to get pregnant now. So fertility preservation means you're preserving your fertility for future. You want to have a child next year, in 5 years, and 10 years, or 20 years down the line. So you're not trying to get pregnant, but you're preserving your fertility. So this is very important. Today's discussion on use of AMH will be on fertility preservation, preserving your fertility for future. So you can preserve your fertility for future in two different ways. First one is preserving your eggs, which is egg freezing, and second is preserving your embryos, which is embryo freezing. So embryo freezing you can do with your partner's sperm, if you're in relationship with male partner, or with a donor sperm. So you can preserve your fertility by freezing your eggs or freezing your embryo. So we will be discussing use of AMH test for fertility preservation. So for fertility preservation, we can use AMH in various ways. First is to establish who actually needs fertility preservation. Second is to establish your baseline fertility. Third is to predict your future fertility. And the fourth is to plan strategies for fertility preservation. So how many eggs you need to freeze and how you're going to use. And fifth is to create protocol for ovarian stimulation, for egg freezing or embryo freezing. Essentially, we use four or five different ways. AMH test for fertility preservation. Who needs fertility preservation? Second is your baseline fertility, long-term prediction of your future fertility, and the strategies for fertility preservation and strategies for ovarian stimulation.
Thank you, Dr. Rusty. My second question is how do you establish baseline fertility?
Okay, so before I explain establishing baseline fertility, I'd like to explain how we use AMH for who actually needs to decide who actually needs fertility preservation. Everyone doesn't need fertility preservation because a lot of women can conceive naturally without preserving their fertility when they are ready to conceive. But some women, when they are ready to conceive, they cannot conceive. Why? Because they have run out of their egg reserve. So we need to establish who actually at risk of running out of egg reserve when they are ready to have kids. So I will take one country as an example and one age as an example. For example, let us take US as an example. Today in US, you have 2.2 million women at the age of 25. If you count all women at the age of 25 in the US, there are 2.2 million. So 5% of them are at risk of early menopause. They don't know yet because they haven't checked their baseline fertility. They don't know, but 200 out of 2.2 million, 5%, which is 110 women who's 25 today, will run out of their egg reserve. So by the age of approximately 40, and their menstrual period stops by the age of 45. So they're at risk of premature ovarian insufficiency and early menopause. In premature ovarian insufficiency, egg reserve can run out at any point. Let us say from the age of, 25 to maybe 37, 38, they run out of egg reserve. After a few years, they have menopause. In early menopause, egg reserve will run out of from age of 40, and by the age of 45, they have menopause. So these women are at risk of having infertility if they start late. So out of 110,000 women, some of them start early, and by the time they run out of egg reserve and they've completed their family, they don't have any issue. They can conceive naturally, they can do fertility treatment, so they conceive naturally, conceive by the time they run out of egg reserve. But a lot of these women need infertility treatment, including repeated IVF cycles, to have a successful pregnancy by the time they run out of egg reserve, if they try later. So, and why they need repeated IVF cycles? Because they produce very little number of eggs. Usually you need good quality embryos, and some women need multiple transfers to get success. And some of these 110 women, if they're not aware of their fertility or egg reserve, if they start very late, they start after they have run out of egg reserve. They have a diminished egg reserve, critically low egg reserve, AMH of 0, antral follicle count of 3 or 4. So they may struggle and they may not conceive. Exactly, this is a group of women, 110,000 women. Some of them need donor egg IVF. So in the future, when fertility screening, fertility monitoring is developed properly in population level, and also fertility preservation technology like egg freezing, embryo freezing is improved and become accessible to everyone, in the future, very rarely women need a donor egg. They act as a donor for themselves. They freeze the eggs if they're at risk. I'm not saying everyone needs egg freezing, yeah, even for future fertility. A lot of women do not, but this 5% of women in the population, they are born with a low egg reserve. If they don't conceive early, for complete their family early, they can be at risk of having infertility, and then they may need a donor egg IVF, or some of them may not even have a successful pregnancy, because donor egg IVF is not accessible. It's very expensive, very complex. It's not simple. So yeah, so this is a AMH test is one of the tests, not only test. AMH and antral follicle count test, and specialist consultation is a way to predict your future fertility. If you have I tell you how you can do it. Let us say you do AMH test and you do antral follicle count ultrasound scan. So after a few months, you repeat AMH and antral follicle count, and you speak to specialist, and you tell the specialist, what is my future egg reserve is like. Specialists can tell one of few things. They can say, oh, your AMH is so high, antral follicle count is so high, you don't need to worry. You know, you next 5 years or 10 years, you don't need to worry. You just do your achieve your professional goals, any plans you are making in the near future, you don't need to worry. Or they can say you have average egg reserve. You just keep an eye on your fertility plans, and just when you're ready, you should start. When you have a low egg reserve or critical egg reserve, your specialist will tell. You have to get on with it. If you can't, complete your family before it's too late, or preserve your fertility by preserving eggs or preserving embryos, so that in the future, after 5 years or how many years, when you are ready to have kids, you will have frozen eggs or frozen embryos. Of course, like we said, when you freeze eggs, of course, a lot of things you need to take into account. It's not a simple solution, but the AMH is one of the tests. Antral follicle count is another test, which tells who actually benefits from egg freezing in the future. And also, okay, so in terms of establishing individual person's baseline fertility, so how we use this, let us say I have a patient who is at the age of 30 who wants to do egg freezing. I give two examples. One patient at the age of 30 wants to do egg freezing. I check her AMH is 3 picomole liters. Yeah, so we're talking about she's got maybe 3, 4, 5 years of functional egg reserve. So and I have another patient, exact same age, so her AMH is 25. So, and I will establish their baseline, and I give very different advice to them. The age is same. I say to patient who has a very low AMH, I say, look, you've got 3-5 years of functional egg reserve. So if you're ready to conceive now, if you can't conceive naturally, try and conceive now naturally and for complete your family. If she says, no, I can't have a kids next 3, 4, 5 years, I said, you need to preserve your fertility. So then, because this will be her plan A, probably, yeah, maybe plan B. But I have another patient whose AMH is 25, her age is 30. I will ask, how soon you're going to conceive? She said, okay, after 5 years. No, fine. Probably your plan A will be to conceive naturally if you can conceive naturally. If not, then you do fertility treatment. Very likely you will conceive at the age of 35. You have plenty of eggs at the time. So if you need to freeze eggs, you can freeze eggs, but depends on how many kids you want to have. If you only want to have one child, probably you don't need to freeze eggs. Very likely you conceive naturally, or you do fertility treatment at the time, because your egg quality and quantity will be good at the time of 35, at the age of 35. If she says, no, I want to have 2, 3 kids, say, okay, when you are planning to have a second child, or maybe after another 3 years, maybe then you may need to freeze some eggs, because you probably use this frozen eggs as plan B. I will explain what's the difference between plan A and B and C for fertility planning. So fertility planning is if patient is planning to have a child naturally in the future when they have a reasonable egg reserve, and also their age is not old in terms of the egg quality. The plan A is to try and conceive naturally. Plan B is doing fertility treatment. Usually it's IVF. If naturally doesn't work, depending on, of course, the cause, if it may not be IVF. Plan B is to conceive using eggs they're producing at the time without using frozen eggs. Plan C is using frozen eggs. So a lot of patients with high egg reserve, if they do egg freezing, usually this frozen eggs they use for the second child, maybe even third child. Let us say this second patient tries to conceive naturally at the age of 35, they have successful pregnancy. At the age of 38, they try to conceive for second child. They struggle a little bit, they can have a fertility treatment, IVF, or conceive naturally. Then they want to have a third child at the age of 42 or 43. Probably they use these frozen eggs for the third child. But this option is not there in patient with a low AMH. AMH is used by all IVF specialists. When you ask people's opinion about IVF, about AMH, they may say, "Oh, I don't know how useful it is." But there isn't any fertility specialist who does not use AMH in IVF treatment or egg freezing, because to decide egg freezing, you need really 3-4 pieces of information. First is age, your patient's age. Second is the egg reserve. What's the egg reserve is like. The advice like this is seen very different in women with low AMH or low antral follicle count, AFC, and high AMH and high IFC. And the third is their plans, how soon they are planning. Always patient women say, "I don't know, I am not even in a relationship, how can I tell?" But best person who can predict how soon they can try to conceive is themselves. As a doctors or GP cannot tell. You have a hunch, you say, okay, maybe 1 to 3 years, 3 to 6 years, or 6 to 9, and that's good enough for us to plan. Of course, we cannot tell exact year when you're trying to conceive. Nobody knows, but this helps us. For me, I give different advice to someone who says, I will probably try after 6 to 9 years, to someone who says, maybe next year I will start trying. It's a very different advice. So this answer may not be exact, but we need to estimate when the patient is trying to conceive. So age, AMH, and when they're trying to conceive helps us to determine the strategy for fertility preservation. A lot of patients do not need fertility preservation. We say, no, you don't need fertility preservation because you will be producing plenty of healthy eggs at the time of conceiving, trying. Just review your plans after 1 year or 2 years or 3 years, if they have very high egg reserve and if they want to freeze eggs when they're very young.